So people with rheumatoid arthritis, omega-3 has been studied in many studies, both to treat the rheumatoid arthritis and to augment or supplement an existing medical treatment of arthritis. And in almost every case, it's hugely successful. So for people with rheumatoid arthritis, omega-3 is very, very helpful. Also, tart cherry extract, very helpful to reduce signs and symptoms of arthritis or pain. And then also things like turmeric, ginger, and PEA. Palmitoyl ethanolamide is not really well known here. It's very well known in Europe. This is a fatty acid amide that's in the same family as CBD. And it is antioxidant and helps reduce pain around nerve endings. So for rheumatoid arthritis, I would say D3, of course, always important. Omega-3, tart cherry extract, turmeric, PEA, ginger, all studied in terms of inflammatory arthritis and all successful. We have another question? We have another question. Hold on.
So, what is like your overall, well, I guess you have to like exercise. There's no like specific exercise.
There's a question about, do I have specific exercise protocol? Short answer is yes, and I'm working on it still to make it easier to understand and put out there. But to start with, walking, I think it's the best thing and the most natural, the most human of exercises, maybe interspersed with a bit of jogging or maybe some high intensity sprints. I try to walk 30 minutes. I try to do it in the morning so it matches my circadian rhythm, 30 to 40 minutes. I try to walk fast enough that it would be hard for me to talk, which is zone 2. And that is 4 mornings a week because I can't do it every morning because surgery starts too early or I'm driving to New Orleans to teach or something like that. But walking 30 to 40 minutes, 4 to 5 times a week is ideal. And I tell my patients, you don't have to do it all at once, especially if you're out of shape and not used to it. I just try to get people at a desk job to get up every hour and walk around the office for 5 minutes. If you multiply that times 8, that is a 40-minute increased amount of activity you've had daily that you didn't have before. Weightlifting, yes. So there are some very highly functional movements you should be able to do. You should be able to get off the floor when you get older. Ideally, you should be able to react quickly and get out of the way of a moving car. In a good, perfect world, you should be able to pick up your grandkids, right? So we're working on multiple muscle group strength-producing protocols that incorporate muscle science to improve strength. And that'll probably be a talk later on. But I think get with a personal trainer or a physical therapist and just tell them you're interested in functional fitness. And there's certain things that you should be able to do when you get older that most Americans are not able to do. And I just listed a few of them.
Just like reiterate your thoughts on bone and oil supplementation.
Okay, somebody wants me to reiterate my thoughts on bone, and will supplementation ever help? So I see this a lot of times. People come into my office and tell me that another doctor told them they were bone and there's no help. You're always going to be in pain and your only hope is a total joint replacement. Okay, so what just happened? Their mindset got completely set in a negative fashion, and it's not true. Again, no x-ray finding has ever been correlated with a symptom. So you can't say that just because you see bone on bone that they're never going to not hurt. And yes, supplementation can help these people because the pain is, again, from inflamed nerve endings and inflammation and oxidative stress. So if you can control the electrical signal from the nerves at the joint to the brain, then you can control the pain without controlling the underlying bone on bone, right? So if you can make the nerves fire less often by giving it omega-3s that are more pro healing and resolving and less inflammatory, by reducing the oxidative stress and inflammation with things like the tart cherry extract and the turmeric and different phytochemicals like PEA and alpha lipoic acid. So if you could control the damage markers, the biomarkers that way, you'll have less pain. And then if you can improve strength, flexibility, things like that, then any given site of arthritis becomes less relevant over time. And then of course mindset helps, and then controlling levels of glycemic indexes in your blood also helps because you reduce the advanced glycation end products, which also cause the pain. So things like berberine, which will reduce your glycemic load in the blood and actually acts like metformin, that can help control pain. Things like resveratrol, that's been studied in conjunction with Mobic and by itself, also very good at controlling arthritic pain. So I don't think that people should just give up because one doctor told them they're bone on bone and all you have left is a total knee. Now, some people really believe that, And I would say do all of this anyway, because when you go get that total knee, hopefully you won't fall into that 20% group where you still have pain, chronic pain for the rest of your life. Hopefully you'll fall into that 80% group that does okay, and you may or may not need a revision down the road, but at least you're doing okay. So yeah, I would say even if you've been told that you're bone on bone, maybe go get another opinion. There are ways to treat that pain with diet, sleep, mindset, supplements.